President Biden says his Build Back Better agenda aims to expand access to affordable health care and childcare. But pro-lifers say they are concerned the bill lacks long-standing pro-life protections such as the Hyde Amendment. At the U.S. Conference of Catholic Bishops warned in a letter to Congress that it is completely unacceptable if the bill supports taxpayer-funded abortions. And joining me now is Jordan Buzza, director of CMF Curo. Jordan, welcome. Great to see you. Let's talk a little bit more about the Build Back Better agenda and what concerns you.
Yeah, thank you so much for having me on. It's a pleasure. As you mentioned, the easiest thing to identify would be the lack of a prohibition on taxpayer funding for abortion, the Hyde Amendment. For decades, there's been bipartisan support because we've recognized that we are deeply divided on the issue of abortion. But in recent years, we've seen abortion proponents pushing for it more and more. And in this bill, we don't have this Hyde Amendment language. So your taxpayer dollars, my taxpayer dollars, would be going to be paying for abortion with this bill.
And Jordan, I understand this bill aims to expand funding of preschool programs. However, it would exclude the funding of Catholic and private programs. What more do you know about that? And what about the implications for religious freedom?
Right. So this is something that is really troubling, and it's honestly a bit mystifying how this is included. One of the great things that the bill does aim to do is to increase access and the affordability of childcare. Right? This is a pro-life, pro-family type of thing that we can support, but the way that it's being done is not something that we as Catholics can really support, because it's creating distinctions in practice by discriminating on the basis of religion, creating requirements that faith-based childcare centers cannot meet, either practically or because it would be a violation of their faith, and giving those funds still to the secular government-run centers. This is something that we've seen really very similar fact patterns in front of the Supreme Court in recent years, where, when taxpayer funds are going to private schools but not to the religious schools, that's impermissible, right? That is actually impeding the exercise of faith. And these types of requirements that get put in place actually creates an entanglement with religion from the government that could be in violation of the Establishment Clause.
Yeah, and what else in this bill sort of raises an alarm for you, and you think that, more people should know about that they maybe don't now?
Sure. So I think on one level, we look at it and it's really just not embracing what we look at in Catholic social teaching, right? It's embracing the idea of solidarity, of making sure that everybody has access to needed programs that are having a way to take care of their basic needs, but it's acting in violation of the principle of subsidiarity, right? Doing so at a level that's closest to people and can enact meaningful change. That's one big issue, right? This is a very large bill. It's hard to know everything that's in here. It very easily could have better effects and be something that we can understand better if it was broken out into multiple bills, right? And then we'd have more clear ideas about what we could and couldn't support. So that's something that we haven't heard necessarily a lot about, but it's not living in the truth of Catholic social teaching.
And Jordan, before I let you go, hoping quickly, you can share with us a little bit more about your organization for those who may not know about it. Talk about your mission, what Christ-centered healthcare looks like, and also how it benefits patients.
Right. So if this bill is not embracing subsidiarity, that's what we're trying to do. We are a Catholic healthcare organization that is really an option for people for their healthcare. But it's more than what people necessarily recognize as coming from healthcare today. CMF Curo, our ministry, we're trying to help people be fully alive in their healthcare, spiritually, mentally, and physically. They can learn more at our website, cmfcuro.org, because so much of what we see in healthcare is broken, and paying for abortions, not taking care of the whole needs of the human person. So we need more solutions like CMF Curo to make sure that the actual needs of people are being met.
Well, Jordan, thank you so much for your time today and speaking with us. It was a pleasure.
Likewise. Thank you so much.